Get answers about the coronavirus from a local expert.
We're joined now on the phone once again by Dr. Erika Hamilton, a microbiologist from UMass Amherst. Dr. Hamilton, thank you very much for joining us here on this Wednesday afternoon.
So let's kick it off with the first question. Can the coronavirus be caught more than once?
Currently, we don't have an answer to that question. This pandemic is so new. We've really only been dealing with it since January that we can't answer that question. There have not been enough people who have been sick with it, recovered, to determine whether or not they can get sick from it again.
And the next question coming in here from Brian P. He is asking, I have a compromised immune system due to the medication I take for a kidney transplant. Should I be doing anything differently than what the CDC suggests regarding this social distancing, the 6 foot?
So this viewer, like many other people who are out there in the population, has a compromised immune system, which does make him and other people more susceptible to COVID-19. Definitely continue following all of the CDC guidelines for social distancing, things like avoiding crowds, not touching people, not coming into contact with a lot of other people. It's up to individual people how far they want to take this. Some people stay in their homes and don't leave and have other people drop groceries off. If you are more comfortable with that, then certainly do it. But definitely avoiding crowds and limiting who you come in contact with is extremely important for anybody who is immunocompromised or has significant underlying health problems.
Absolutely. And last question, this is from Deb F. Should we be avoiding cash? We've seen this from a lot of restaurants lately, taking credit cards only. And she goes on to ask, should we be washing our bills or change?
At the moment, there is no known case of COVID-19 that was spread through touching money. And it would actually be a pretty unusual way of catching the disease. There are far dirtier or far more virally covered things out there that you could touch that you would pick up the virus from. So for regular people, no, you don't need to wash your money. However, for the folks who are still working in grocery stores and in pharmacies who may be coming in contact with a lot of items that have been touched by other people, credit cards, money, the item that someone has picked up off a store shelf, they should be washing their hands, not touching their face, and using hand sanitizer in case the virus ends up on any of the items that they are touching.
Very good there, Dr. Hamilton. And as you said, I mean, credit cards as well, something else to keep in mind. We appreciate your time here today. We appreciate you coming on here, continuing to bring answers to our viewers at home and really to everybody here in the Western Mass community as we continue to watch these unprecedented times unfold before us. We appreciate your time. Stay healthy. Dr. Erika Hamilton, once again with UMass Amherst. She's a microbiologist. Take her seriously.